The progress we've seen these past few months in beating back COVID-19 has been nothing short of remarkable. In just over 1 year, we've undertaken an incredible effort to manufacture multiple highly effective and safe vaccines. And we've undertaken literally a warlike vaccination campaign to get shots into the arms of the American people. On January 20th, when President Biden took the oath of office, only 1% of adults were fully vaccinated. But today, over 50% of American adults are fully vaccinated. And not to brag on New Hampshire, but over 70% of adults in my state have at least one dose. While these statistics are encouraging, more must be done as we begin to see the signs of vaccine hesitancy among certain populations. A key component to our continued vaccination efforts is ensuring that we have hard data collected to ensure that we can improve access in rural communities, including my district. And that's why earlier this year, I introduced the Immunization Infrastructure Modernization Act, bipartisan legislation that would improve and expand information sharing between state and federal governments, as well as public and private healthcare providers, to ensure that vaccines are being administered effectively, efficiently, and fairly across all states and territories. Immunization Information Systems, IIS, are secure, multifaceted systems that allow for the sharing of crucial information and the maintenance of records. My bipartisan legislation aims to bolster these systems and support real-time immunization record data exchange and reporting. Dr. Garcia, you identified in your testimony deficiencies in our immunization information systems, many of which could be improved by advancing my bipartisan legislation with Congressman Bouchon. Can you discuss why it's so important for immunization information systems to be consistent in the type of data collected and reported?
Yes, thank you for that question and for your leadership with regards to addressing the importance of a strong and robust immunization infrastructure. That is indeed really a core part of what we need with regards to our public health system and our public health infrastructure. What we have seen, for example, has been over the years that actually the immunization information systems have not kept up to pace with regards to the need for funding to ensure that we have really robust, comprehensive immunization systems that can do the type of surveillance, whether it's in the detection of outbreaks, being able to tailor interventions because you identify that there are certain populations and communities that either for hesitancy or for access have not been immunized, and then being able to ensure that there's interoperability of these systems, as well as ensuring that the programs themselves and the immunization program itself has the ability to do the type of vaccine education and outreach. And so as we think about, certainly within the context of the COVID-19 pandemic, how critical that is for then local communities as well as states to be able to tailor interventions to be able to get resources to those communities that are under vaccinated. It's also important in the longer term as we think about shoring up our immunization infrastructure to be able to detect and assess and address the next emergency.
Great. And Mr. Offerman, thank you for joining us and using your platform to encourage Americans to get the COVID vaccine. You speak to the effects the pandemic has had on your work in the entertainment industry and how by listening to doctors and trusting each other, you and your colleagues were able to safely get back to work last year. Since this was a successful strategy, how do you think this can help our national vaccination effort, particularly in rural areas like the one you grew up in?
Well, I think it's just a matter of extending the leadership that our other witnesses are talking to and getting this clear messaging to all of our citizens who are confused by the information they're getting. That comes from a variety of reasons: misinformation, conspiracy theories, mistrust, etc. And I think we just need to turn up the volume on the clear information that it's safe. Everyone should do it. It's your duty as a family member. If you love yourself, your family, your community, it's beholden on all of us to step up and be a good neighbor and a good family member. And just shout that to the hills.
Great. Well, thank you for helping us shout that to the hills. And with that, I yield back.